Well, good morning and welcome everyone to Reopen Connecticut Arts Venues, Science-Based Safety. I'm Eric Dillner, the CEO of the Shoreline Arts Alliance and the chair of this task force. The mission of our task force, as many of you know, is to offer the opportunity to reopen your arts venues from a public health perspective, and of course, remain open with professional guidance in the workplace and in your artistic spaces. We want to provide a listening and sharing platform, which we'll do today, and we want to help build consumer confidence through science. Our goal is always clarity, practical science advice, and an opportunity to ask questions related to your risk reduction strategies. Together, we're strong, and with this science-based safety, I know we will have much more knowledge and we can survive together. We, of course, want you to feel free to share this information broadly with all of your colleagues. We have today, of course, are going to be missing many of our friends from Louisiana. We were thinking about you all when you get a chance to see this webinar, and we know that we're here. We just want you to know we're here for you when you're able. Many of you know that I ran an opera company down in Louisiana for about a decade with the in Louisiana during Katrina, and I'm feeling for you all in a big way. So I know that we're here for you. Just know that. To date, our webinars has reached over 15,000 viewers in over 18 states and 3 countries. We're thankful to many different foundations, which you saw run earlier in the slides. But I just want to mention a few: Emily Hall Tremaine Foundation, Connecticut Office of the Arts, Community Foundation of Greater New Haven, and Community Foundation and Community Connecticut Humanities. So thanks again for being such an incredible partner with us. Along with our big, huge advocate, Yale School of Public Health. You all have given us a tremendous gift to help the arts community at large. We encourage everyone to attend each of our webinars and follow Shoreline Arts Alliance's YouTube channel and Facebook for additional information. You may also find many other resources at Yale's website and at shorelinearts.org. Our website is now fully accessible, and as you can see, there's closed captioning available today, and you're more than welcome to turn that on or off during the webinar. Remember, we use the chat for sharing resources and the Q&A for asking questions. So please use those appropriately. I'm so pleased to introduce my co-chair, Sten Fairmoon. Sten is the Dean of Yale School of Public Health, and he's holding the Anna M.R. Lauder Chair, excuse me, in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. We're also so honored to have with him another important advocate, Crystal Paulette. Crystal is the assistant professor in the Department of Environmental Health Sciences of the Yale School of Public Health, and she holds an appointment in the School of Engineering and Applied Science. Her specialty is indoor spaces. So thank you both so much for caring so deeply about the arts community. Today, we will address the big questions for us all. How do we adapt to this ever-changing landscape? What factors should we be considering when we plan for our day-to-day operations with this crazy Delta variant entering our state? Are masks required? Proof of vaccination? Social distancing? What are the things that we need to be thinking about? Staff rotations, number of folks in our buildings. So before we get into all that, Sten, let's just step back for just a moment and think of, help us get started with a little bit of a COVID update. Looks like the numbers are rising again, but we're in a good spot in Connecticut, but in the nation, we're struggling a bit. So Sten, would you mind sharing a little bit about COVID and where we are today? Sten?
Certainly, Eric, thanks very much. There was a great paradox, which is as we were increasing vaccination rates and reducing the susceptibility of large chunks of our population, including everybody listening to this call, I hope, we had rates of COVID going up. They even went up in the summer when we have a lot of favorable features of outdoor living and warmer, moisture air, which are unfriendly to respiratory viruses. So why did that happen? And that's all because of the Delta variant. So the Alpha variant that originated from China, if I were infected and I were in a group of you, I might infect 2 of you. But if I have the Delta variant originating in India and I'm in a group of you, I might infect 6 of you. So it's much, much more infectious. So what happened was you had more efficient transmission of the new variant among the people who remained susceptible, so among the unvaccinated people. And this then fueled an increase in the numbers, which seemed paradoxical since we had a decrease in the number of susceptible people. Now, keep in mind, too, that vaccines are not like a bug zapper. It's not like the virus touches your body and then immediately goes away. No, it doesn't work that way. You can be infected if you're vaccinated, just like somebody else. It's just that your immune system has been primed and it responds aggressively and successfully to neutralize the harm of the virus. It down modulates the severity of the infection. So you're much less likely to get symptomatically ill. You're much less likely to get hospitalized. You're much less likely to die. So just to give you a sense of the magnitude of this, we think that with alpha variant, you're 18 times less likely to get symptomatically ill and 25 times less likely to be hospitalized or to die. And that's huge. I mean, 25 times less likely, that's fantastic. With Delta variant, it may only be that you're 6 times less likely to get symptomatically infected, symptomatically ill from infection. So it's not as dramatic. So more vaccinated people will get symptomatic disease with Delta than with Alpha. However, the protection for hospitalization and death holds even with Delta. So we still derive immense benefit from vaccination against the Delta variant. Now, what does this all mean for the arts? Well, the stakes are high for the arts. We need to start getting back to live events, and we can't sustain our businesses with the physical distancing requirements. So what art organization after art organization have started to do is very much what the sports organizations have done, which is that when you buy a ticket, you acknowledge that you're going to bring your evidence of vaccination with you, or you're going to bring your COVID-19 test result saying that you have been tested negative within the last 48 hours. And everybody from the NBA to the Berlin Philharmonic have instituted that as a way of getting in. The Disney Theater in Los Angeles, LA Philharmonic. I mean, this has become almost an industry standard to ensure consumer confidence in safety when observing a live event. And I think that's reasonable. We don't allow people to smoke in our theaters. We don't allow people to do anything that's unsafe in our theaters, and requiring people to either be vaccinated or be test negative is a way of not outing unvaccinated people, not denying services to unvaccinated people, but to additionally require unvaccinated people to demonstrate that they're not a menace to others. So these are some of the things that we might want to talk about over the next hour.
That's such a great intro, Sten. Thank you so much for setting the stage for that. So just for a second here, I'd like to pass it over to Crystal and ask, so Crystal, in this case, with Sten outlining that very clear path for us, do we still need to be mindful of our air handling systems in our indoor spaces?
So happy that we keep on incorporating these layers of safety, and ventilation being one of them. So absolutely. So vaccination is what we had hoped for from the beginning of this pandemic to really be the most effective way for protection, but all of these other layers are incredibly important as well to keep in mind, from the ventilation to the hand hygiene. it's important to continue maintenance of good air handling systems, and that's going to be valid for SARS-CoV-2 as well as many other viruses and respiratory pathogens.
Great. So can you just remind us again, talk to us about the MERV filters, and just give us a reminder for those of us who said for the last 3 or 4 months, we don't need to worry about that and threw those notes away. Maybe you can help us remember, and also if there's anything new, throw that in there for us.
So everything that we've been talking about over the past year still holds.
Okay.
So thinking about how much outside air is coming into your inside space. So making sure that you're trying to maximize that outdoor air coming in. And when it can't all be outside air coming in, when you have to start recirculating, reusing that indoor air, making sure that it passes through a filter. So if it's a HEPA filter or if it's a MERV 13 filter, that's going to remove much of those airborne pathogens, including SARS-CoV-2 effectively, as long as it has a very high rate that it's going through it.
So I think we're going to ask a lot of questions that are really specific to specific industries as we get going, but could we also talk about masks for just a minute? Is it, you know, we learned so much from your study about the masks and the different uses, I'll say, of belt covers for the instruments, and the different types of masks to try to control the droplets when we're playing the flute or when we're playing the trombone or whatever. So are we still encouraged to do those kinds of things in, I'll say, in the adult environment? I know the children's environment may be a little bit different, but in the adult environment, should we be, if we're assuming that they're all vaccinated and all that, should we still be doing that?
So in light of the Delta variant, potential for people to be still unvaccinated in some spaces, yes, so masking is important. And all of the same measures that we have discussed about the types of masks, those all still apply. So there's been so much study and research to optimize the types of materials used for effective removal of virus for protection, from using minimum like a 3-layer mask as being very effective. So having a cloth mask with a filter, or using an N95, a KN95, which are more readily available, making sure that there's a good fit around the nose, sides of the face, and chin. Those all still are very much valid. That's
great. So we just got a question in, actually, that it goes right in line with this. So it's a long question, but I'm going to read it to us anyway, so that we can think about this. If an orchestra is distanced minimum of 3 feet between players, okay, the space is large and adheres to the CDC ventilation recommendation, and winds and brass use masks and bell covers, are there any additional precautions that we should recommend in a 3-hour rehearsal? So lengthier breaks, or bringing the wind and brass players for a smaller portion of the rehearsal, for example. You know, what other things should we be thinking? And then, of course, we'll talk about string players and kids, but maybe what are your thoughts about that?
So having all of those layers of protection are exactly what I would be looking for in trying to increase the safety within that space. So making sure that those minimum ventilation requirements are met, trying to enhance those further if there's any type of higher risk individuals that are present. The use of the covers is excellent. Limiting the time that the instruments are being played is going to minimize the amount of aerosols that are present.
And so what about when we have kids and we know they're not vaccinated? Is there anything more we can do?
So everything that we've been talking about over the past year, we're still sticking to those protocols, because we know that they are effective, but it's absolutely necessary that they be layered. And the more layers that are present, the more that we can enhance the safety within those environments for children that are unvaccinated.
Great. So really, if we can have our kids practicing outdoors, or you know, I mean, I just drove by a college the other day and there was the band outside. It was clear they'd been there all day long, you know, practicing. outside. So if we can still do that, that's a great thing, right? That helps us a lot.
That's right.
Yeah, absolutely. Okay, good. Well, Sten, let's see. We have a couple of questions that are going to drill down a little bit about the vaccine. Judith from 5 Point Center for Visual Arts has a couple of questions for you. Judith?
Hi, Sten. It's good to see you again. Hi.
Thanks,
I
Judith.
understand how the performing arts organizations, the large ones, the big theaters, and I get that a proof of vaccination can be very helpful. But how about some of our, I would say venues where we're offering classes or people are coming in for tours? Do you recommend we also ask them for proof of vaccination? That's would be a whole other role for us to play. And sometimes these are fairly large groups.
Sten, are you with us?
I don't think so.
Oh, here he is. Here he is.
I'm back. I almost got into my office, but so I'm still in my car. But because I had to go from an event at the Columbus House, homelessness and COVID event for the media. But we have, the fact that you've even asked the question alerts me to the complexities. And I can't say that I have a glib and comfortable answer for you. I think we would probably have to work that out together. So when you think about visitors in a large group, we're not really excited about large groups when COVID rates are on the upswing to begin with. So is there a way, while COVID is on the rise, for us to limit the size of visiting groups? Is there a way to use masks, physical separation, just as we've done in museums? I mean, museums have been open for many, many months, even before people were vaccinated, and we've kept museums safe. But what we've done is we've restricted access, and we've kept the distancing to a maximum and the crowding to a minimum. And it may be that would be the kind of strategy that we would deploy. But I do think that if you have classes where you have students in the classes who are coming to you regularly, if they're under the age of 12, unfortunately, we are going to just treat the circumstances as we did previously. Well, we're going to try to keep those kids safe. But if they're over 12, you could say, we would like everyone to be vaccinated in order to come to the dance studio or to the music group or whatever. And just try to encourage vaccination in that pool of individuals, because that will be a way of ensuring that everyone's being kept safe.
Is there an app that can be used where people can show their proof of vaccination that would make it simpler than having people fish in their pockets?
I was in Europe about a month ago, and the European community has a QR code, and all of the ministries of health throughout Europe have invested in this code. And every time someone's vaccinated, your data goes into this system, and then all you do at the airport is show your QR code. It documents that you've been vaccinated. The United States, in its wisdom, has chosen not to do this, and all we have is state by state codes. And for example, California has such a thing, and New York has such a thing, but there are a lot of glitches, and Connecticut does not have such a thing. So I contacted the State Department of Health not long ago, asking what their intentions might be, and they do intend to create an app. And there is a way now for Connecticut health providers to find out if someone has been vaccinated, if there is a medical reason to know that. So we have the potential to do this, but we don't. So imagine how easy it would be to have a little stand outside your venue, and all someone has to do is take their cell phone, their smartphone, and show their QR app, and they're admitted to the concert or to the activity. So we are not there yet, I'm sorry to say.
Yeah,
Thank you,
Sten, thank you so much for mentioning that we're not there yet, and that some others are. I have to say there are some really innovative groups here in Connecticut and across the country who have taken it upon themselves as institutions to do so. But it's a struggle. It's a struggle because you have to have equipment, and you have to, there's a lot of things that are associated with that. So we're actually, as a task force, trying real hard to help give you some guidance on that. As we move forward, we're studying all the different apps, and we, like Sten, will continue to push forward to get folks to help us find ways here in Connecticut to do that. John Carl from the Connecticut Nonprofit Alliance. Yes, go ahead, Sten.
Well, I was just going to say, Eric, if you pick on Crystal one more time, you'll give me the 5 minutes I need to get my...
All right, we'll do that.
Okay, good. I'll rejoin you in 5 minutes. Thanks.
Okay, great. So actually, John Carl, why don't you go ahead and ask the question that you're prepped for here, and we'll see what Crystal's take is on that.
Hey, thank you, Eric. Good morning, everybody. Hi, Crystal. My question is about unvaccinated employees, and this is something that affects all employers, but of particular interest to people in the arts. What is a reasonable requirement for unvaccinated employees to ensure the health and safety of everybody? Should we have masks and social distancing for them? Should we test them before rehearsals and performances? And if so, how often? How often and what kinds of tests should be required? I've struggled with this myself as an employer.
So I'm going to turn this back to Sten when he comes back on the line to talk about the frequency of testing. But that's being a common strategy, is to require, if or there's an exemption for some reason the vaccination person doesn't have, is to require the more frequent testing if they're to be regularly on sites. Then coupled with that, having all these later strategies that we've been referring to. So the requirement for use of masks, to have the physical distance within the space, and also ensuring that the space that this individual is in, if they're regularly at the venue, is well ventilated. So that could either mean through the HVAC system, making sure that you have those MERV filters in there, high rates of air change, or by having these portable HEPA air cleaners, or the DIY ones that we've mentioned before, placed in the space.
So Crystal, just to tag onto that a little bit. So when we're talking about an office environment, can we, this question seems to come up an awful lot. Can we consider that a family group, so to speak, when they're spending all this time together on a daily basis, or because they're actually just there for I'll say the 8 to 10 hours a day, in the arts, probably 20 hours a day. But if they're there for a good bit of time together every day, are they considered that family unit, or not so much because they're headed off to their other family unit in the evenings?
I think we had this challenge earlier on in the pandemic, as well as, what do you consider to be your family units? And that becomes ever enlarged by expanding it to the office space as well. So if that's something that can be maintained to a smaller number, that's great, but it's important to then just consider really what that means in terms of the number of people that you're interacting with.
Right. Great, thank you. And Becky from the Florence Griswold Museum, how are you today? Thanks for being here. Do you have a question for Crystal?
Sure. So just kind of following up on that, Crystal, as we're looking at staff members returning to the office, as much as possible being on site, should we continue to have modified staff schedules to keep our numbers lower, to offer less contact between them? Does that make a difference at this point?
I think going back to what Sun had mentioned, it's important to maintain that high level of vaccination, and that's going to drive the types of protocols that are in place. And perhaps now Sun's on the line, might want to elaborate on the types of protocols that might be necessary in office spaces.
Sure. The risk of any kind of serious COVID event between vaccinated office colleagues is exceedingly low. So the notion of maskless office work among vaccinated colleagues is reasonable. However, as I said earlier, vaccines don't they're not like bug zappers. They don't prevent the virus from getting into you. You could get infected, you just don't get so sick. So if there is a vulnerable individual in someone's household, an immunosuppressed elderly relative that you're caring for, or a child under 12 who's not immunosuppressed but who could get COVID, then one might want to be a bit cautious. So let's say that I'll use my example, my office as an example. There are 1, 2, 3, 4 of us, and 2 out of 4 have children living with them at home. But both of those family groups, the kids are over the age of 12. So we are now a completely vaccinated whole. All of our spouses and partners are vaccinated, our children are vaccinated. So that we would wear masks would be redundant and would not be a high priority. However, if one of my office mates had a vulnerable individual at home, and if I were in proximity to that individual, if I weren't in a separate office, if I were in a carol situation, for example, then it would be prudent to wear masks.
John Carl, do you want to follow up with that?
Yeah, I'd asked Crystal earlier about what we should be doing regarding the frequency of testing for people who are unvaccinated in the workplace, whether it be before rehearsals and performances or just in any kind of office environment. And really sort of building off that as time goes on, are we going to soon need to require proof of booster shots on top of everything else?
So last year at Yale, we had our students who lived in residential housing. So by definition, they were in close contact with one another. And because the COVID pandemic was raging in the state of Connecticut, we were requiring twice a week routine testing. That may sound like overkill, but that actually did a very good job keeping our campus safe. Because COVID rates are considerably lower now than they were last year, we're now requiring our students to get weekly testing. So if one were to reconvene the office environment, having weekly routine testing for unvaccinated individuals would be a reasonable approach. When one talks about events, certainly ensuring that performers and staff of the event are COVID negative within 48 to 72 hours before the event would be prudent. And it would be urgent for unvaccinated such persons. And if you want to not be discriminatory, you could test everybody 48 to 72 hours before, even the vaccinated people. But the urgency would be in the unvaccinated people.
I think that's a great segue to Becky's next question about COVID tests.
Yeah, so thinking about the idea of potentially vaccinating testing staff before an event or testing everyone, is there a place that we can order self-administered COVID tests in bulk for our sites?
So you're talking about the antigen test as opposed to the PCR test. And the antigen test is not bad. It's not as sensitive as the PCR, but it still will detect the higher viral load individuals who are the greatest menace, if you will, to others. And bulk purchase is almost always available through corporate entities, but you tend to have to buy a lot. So that would be the kind of thing that the Connecticut Arts Council or Shoreline Arts Alliance, all of you banding together, might do some research. Some people wonder, why have there been so many medical hospital mergers where two rival hospitals merge and become one entity? One of the main motives for that has been bulk purchasing agreements, so that each of the hospitals can obtain all the supplies, medicines, everything at a much cheaper rate. And at the end of the day, that has been a boon to keeping hospital costs down. So if you wanted to do something across the state, then you might derive benefit from these bulk purchasing agreements, but you'd have to be very careful in your planning, because you don't want to buy too many and have them go to waste. And if you buy too few, you can always buy a few more. So optimizing the magnitude of the purchase would be important. But I doubt that Florence Griswold or some other museum or arts venue would derive much benefit from bulk purchasing, because you wouldn't be buying enough.
So that,
But I'm
thank you,
guessing.
Sten. That's
I'm
really, go ahead. What was that, Sten?
I'm just guessing. I'm not
Yeah.
an expert. Hold on.
Well, so we'll send a survey out after this webinar, but feel free to in the chat if you'd like to send me some private directed messages today. Yes, I would be interested in being a part of such a purchase plan, or to learn about that. Why don't you all go ahead and start sending me that information, and we'll figure that out. As you know, we've been talking to several different entities about helping the institutions as a group. And I think many of you heard in our last webinar that Shoreline Arts Alliance was gifted, or is in the process of being gifted, 1 million masks so that we can help have them available to your audience members, et cetera. And our first shipment went out last week to one of our groups, and we're about to have a large outpour throughout the state to get them to you all. So if you haven't put a request in about masks, also make sure you do that. Actually, that would be best if you send that to office@shorelinearts.org, because we're in the final stages of getting those numbers. And if you think your numbers have changed, don't worry about that. Send us that update. So great. Thank you for that segue. I think anything we can do together as a team is going to make life better. And we'll see if we can do something about this testing. Frank from the Palace Theater, welcome. Good to see you this morning.
You as well.
We would, why don't we stay inside for a little bit? Why don't you help us discuss some of those other issues?
You got it. Thanks, Eric. And Crystal and Sten, I wish I could say it was good to see you again, or that we're still having this conversation. No disrespect. But just, yeah, from the inside perspective, Sten, you addressed this already, but performing arts centers like the Palace and our sister organizations, we are all implementing policies which are proof of vaccination and or proof of negative test upon arrival, and the requirement to wear a mask. Given us following all those protocols, is there any concern as we ready ourselves to open up to full capacity that there may be some suggestions to reduce the number of people within our spaces? If we follow all the steps, is it okay to maximize the number of the people in the building? And assuming our ventilation system's in place as well.
You are going to get a diversity of opinion from so-called public health experts like us on that topic.
Mm-hmm.
My view is that a vaccinated and or test negative audience wearing masks is an exceedingly safe audience. It will be helpful if you've got your hand sanitizers.
Mm-hmm.
It will be helpful if you maintain some of the online ticket purchases that you've done in the past, minimize crowding around the concession area, around the box office area, maintaining some sanitation of your restrooms, everything that we've talked about ad nauseum over the last 18 months. Not a bad idea to retain those favorable hygienic precautions. But I don't get excited about, I've been to a couple of events just like the one you described. I felt completely comfortable. I felt completely safe. And the reality is we'd like the proportion of vaccinated people to be continually going up. But Eric alluded to this earlier on, we're quite privileged in Connecticut. When I checked the statistics before my trip to Africa last week, it was 51% vaccinated, fully vaccinated Americans, 65% in the state of Connecticut. And by now it's probably 67, 68%. And that includes all the kids. So that means we're probably up to 80% of adults. So that is considerably above the national average, and that is to our benefit in the arts community.
I want to follow up on that because you opened with that there would be the likelihood of varying opinions from health professionals, et cetera. Is there a fear? Should we as a venue be concerned that the state may choose otherwise and try to mandate or dictate some kind of capacity limits? Has that been discussed at any level in your meetings?
I would be cautiously optimistic on that point because, I'll dramatize my answer. A year and 3 months ago, we had 450 people in Yale New Haven Hospital, a third of whom were in ICUs, and we had deaths every single day. Beginning of the summer, we had 14 people, not 450, 14 people in Yale New Haven Hospital, and a couple of days we had nobody in the ICU. Now we've had around 40. Now that's not good, 14 to 40, wrong direction. But 40 is not 450. So with rising vaccination rates and some reinstitution of precautionary measures like masking, I fully expect that that those rates are going to come down. And by the way, some of our data that Crystal is very involved with, the sludge surveillance data, does suggest that things are coming down. So sludge surveillance is where you check sludge from outgoing sewage and you check the positivity rate, and it's a way of measuring community risk. And Crystal's worked with her colleagues in the engineering school to do very important work in the state on that surveillance innovation. So I think you're going to see rates dropping over the fall. Now, if we get a little bit of a starting school surge, I wouldn't be surprised, but I still think overall in the fall, we're going to start with falling rates. So I don't think the pressure will be on the state Department of Public Health or the governor to have rigid number limitations, because you don't want to do that if you don't have to, because it's bad for business.
Right on. Thank you for taking the math out of our own hands and you doing the simple math for us, and that was very helpful, I think, for all of us. Darren from Flock Theater, do you have anything you'd like to follow up with there?
Yeah, I've got a couple questions which probably may fall more into Crystal because it's mostly about filtered and ventilation and things along those lines. And, you know, part of this, I think, also just bears repeating. In one of the venues that we're working in, we've put in those jury-rigged or human-made air filter things with the MERV 13 rating. And if you could just again go over how effective that ventilation is at preventing viral transmission? Has ventilation guidance changed at all over the course of this? And is still that MERV 13 filter the first line of defense? And with those made ones that we've implemented throughout our space, how frequently should we change those MERV 13 filters? Should it be monthly? Should it be quarterly? Should it be dependent upon numbers of people going through the space? So those are a series of questions about air filtration.
Fantastic question. So prompt me if I forget to answer anything here. So all of the guidance that we've talked about for air handling, that remains as is. So maintaining the high number of air changes within your space. If you have a central HVAC system, or if you don't have an HVAC system and you're just relying on natural ventilation with your windows and doors. So you want to make sure that you have a lot of outdoor air coming in as possible. If you don't have that outdoor air coming in, then you want to then be using a way of filtering that recirculated air that's staying within the indoor space. The MERV 13 filters still holds as being a great tool for being able to filter out SARS-CoV-2 and other aerosols that you would find in there. So as we start getting into flu season, that's going to also be great for lowering risks of getting sick from other pathogens. If you have access to a HEPA filter, just like we've talked about before, that's one step above the MERV filter in there. That can be done using either these filters that you put into your HVAC system, if that's available, or by building these DIY units or commercially available air cleaners. So the air cleaners that you purchase, it's incredibly important that they have a HEPA filter inside and not some sort of ionization system or electrostatic system or lots of other marketing tools that are using a chemical process for removing aerosols there. Those can lead to a lot of other hazardous secondary products that they generate that we don't want to have then other downstream adverse health effects there. So always a HEPA filter. I'll put a link into the chat there for these DIY units. So this is by taking a box fan that you can purchase from your local hardware store, Amazon, and just simply by putting a furnace filter, so a 20 by 20 inch type of filter, and just using even duct tape to make sure that you have a really secure seal on there. These box fans move an incredibly large amount of air that we've discussed last time, so over 1,000 cubic feet per minute. So yes, they are still incredibly effective at reducing risk.
And just real quickly with those DIY filters, so how frequently should those filters be changed out, if at all, on one of those DIY box fan filters?
So if they're being used inside and they're not being placed by a kitchen area where you have a large amount of soot that might be coming off, or particles from some sort of combustion, or you're not operating it by a fireplace, those can stay on for a number of months. So changing it maybe every 6 months plus, you're not going to be having high loading on there. In places where you have, say, wildfires, and that's leading to blackness and loading, there you would have more frequent changes.
Thank you.
Thank you. Thank you both. Thank you so much again, Crystal, for all that good info. John Carl, you're thinking about fundraisers and conventions and things like that. Can you help us ask a few questions about that?
Yeah, in fact, we have, as an organization, we were hoping to be able to have a person-to-person convention with 600 people, as we normally do. We've decided to do a remote convention again later on this year, but many organizations are wrestling with that question right now. They're doing fundraisers, they're having their annual events like conventions. If you go ahead and do that, what kind of protocols should folks be considering? And as you sit down with the venue staff and talk about things, what should you require? Should you require them to wear masks, for instance? Or are there other things that we should be pressing folks on?
So we've confronted this recently. August is retreat season for Yale. We have the cabinet retreat. We have the Yale School of Medicine retreat that they invite me to. And with the cabinet is a small enough group that we're able to parse ourselves in, some physical distancing and feel comfortable. But School of Medicine is a really big operation, and there must be 80 people routinely who come to that retreat. Now, it's not 600, but still 80 is a good size. And in consulting with the School of Medicine dean, we settled on a protocol to make it especially safe, which was everybody get a negative COVID test within 40 to 72 hours before the event. And given the fact that like 99% of those people are vaccinated anyway, that really was very conservative. And that really did the trick. Everyone felt very, very comfortable. And I'm happy to say that the Yale School of Medicine retreat was not a super spreader event, because you would have read about that in the newspaper by now if it had been. But the point is, I don't think we have to be paralyzed in our event management if we use this strategy of convening people, ideally who've been vaccinated, and if they haven't been vaccinated, who have negative test results. That could be a way of restoring some of our conventions and our group gatherings. And our events and our arts events, as Frank was saying earlier.
Thank you.
Thanks. I think that's so important as we move into the winter. So many of us have not had fundraisers for a year and a half, or we've tried the online, and some are successful and some are not. So thanks for that really important information about, encouraging our audiences basically for our fundraisers to be much like what we think if we're going into a theater or to a museum. So thank you for that. Okay, let's move outdoors. Judy Dworin of the Judy Dworin Performance Project. Would you help ask a few questions about outdoor performance settings?
Sure. Nice to see you, Sten. And I wanted to just ask about going outdoors for performance. You gave great instructions the last time, and I'm wondering if they still hold. Is it safe for performers outside to be without masks? And I'm talking about singers, dancers, and speakers, actors. And if it is safe, then what is the distance they need to be between each other and with the audience?
Well, Crystal and I have been pretty consistent, I think, that outdoor is safer than indoor. And we've also been a little bit on the cautious side in the pre-vaccine era. And I'll be interested to hear what Crystal has to say about this in a moment. But to answer your question, from my point of view, I think that if you have vaccinated performers working outdoors, I'm back with Plobolus. I'm back with Laertes and Hamlet dueling. I mean, I just feel like there isn't any restriction that I can think of that would be something that I would worry about. You can be especially cautious when you test your performers before the first rehearsals, so that you start your rehearsals and your performance in a virus-free zone. And you could even test your vaccinated performers, not that hard. But I believe that vaccination was a game changer. And with the exception of those individuals who have very vulnerable people at home. So even getting infected and having nasal passages with virus could be a risk to them. And about 4% of the US population is immunosuppressed in one way or the other, heavily weighted toward the elderly, obviously. So that is something to keep in mind. But my view is outdoor events with vaccinated performers are exceedingly safe. Crystal, what do you think?
We're on the same page on this one.
Okay, well, that's helpful. And so I have a question that kind of goes back to testing, and then I'm gonna go back to outdoor audiences. But when you talk about someone getting tested, is it fair to ask someone to be tested and then to quarantine until they come to, in other words, if they get tested on a Thursday and they have to report for the performance on, and they're unvaccinated and they're reporting for a performance on Saturday, is it fair to say they need to quarantine until that time, because otherwise that test is only for Thursday and anything could have happened on Friday, on Friday? Or is that being like overly cautious? Does that make sense?
Oh, it makes perfect sense. The reason I'm even hesitating is it's so disappointing to hear that people in the performing arts are not willing to get vaccinated.
Yeah.
I mean, safety in the performing arts, that's the lifeblood of what we're doing in the performing arts.
Yep.
And why wouldn't we want to keep each other safe? Don't we have enough community spirit that even if we're not enthusiastic about vaccination, we would vaccinate ourselves just for the sake of our audience, or our fellow performers, to minimize risk?
Yeah.
So where did this selfishness creep into the performing arts community? That's not the performing arts community that I grew up in. But anyway, that's a little sidebar comment. If you do have unvaccinated performers and you can't do without them, then the extremely cautious approach would be get a test and quarantine. That's not particularly realistic. And I would think that an alternative would be to say, look, after your negative test, after your test, you're going to find out what the result is the next day or perhaps the same day. Please be very fastidious in your personal behavior. Please no party events, no unmasked shopping trips. Please make sure that you stay virus negative until the performance is finished. And then you can go back to your unvaccinated lifestyle.
Okay, thank you. And my last question is just, is it, when you have an outdoor performance, should the audience wear masks? I know that, for instance, in the city of Hartford, they've mandated masks inside, but outside there isn't any sort of set guideline. And particularly if it's a large performance, and another side of that, which would be more extreme, would be asking people to show vaccination cards to come to an outside performance.
I'm a fan for any group event having its participants either be vaccinated or demonstrated virus negative. I don't think that's unreasonable. I think that's smart pandemic control strategy, and a good way to try to avoid super spreader events. In terms of masking, you have the immense dilutional benefit of outdoor activities that Crystal has told us about in past sessions, and that is a huge boon. So if you have a vaccinated audience or a test negative audience, I'm not sure what the value added of masks would be in an outdoor setting. So one could consider those to be optional. Indoors, Palace Theater, I'm happier to wear my mask. Give you an example, Yale University. It might sound like overkill since we have 98% of our students vaccinated, 94% of our staff and faculty vaccinated, and the numbers are going up every single day. But we're going to be wearing masks when we're teaching. And that's because we're not teaching outside.
Mhm. Okay.
Now, if rates start to drop, we may take the masks off. So ask me in a month.
Okay. All right. Thank you very much.
Crystal, did you want to add to that?
No, that was very well answered.
All right.
So
I'm
we
always
haven't,
nervous when I answer before Crystal because I'm nervous she maybe won't agree with me.
well, we always said for just a minute something about service transmission early on, but I know that Darren has a couple of specific questions about service transmission. Darren, do you want to pop in with those?
Sure. Again, sort of looking at outdoor events versus indoor events. I mean, is it okay to handle cash at an outdoor sale, a festival performance, again, versus indoor? And should we continue to curb refreshments during intermission or say at a reception or anything along those lines?
I think, you know, at the beginning of last year, the sort of prevention measures were sort of presented everybody as co-equals. Masks, physical distancing, hand hygiene, you know, air quality, outdoor events, testing, vaccination, like all these things are like equal. Well, guess what? They're not equal. Vaccination is probably better than all those other things combined. Not probably, it is better. And then comes masks. Because this is a respiratory virus, it's transmitted through the air, and I want a mask and I want you to have a mask, and that's a double protection. And I think one of the more overrated elements has been the hand hygiene. We've recommended this on a theoretical basis because if I cough and I have COVID, if I have coronavirus and I cough and I populate the surface of my desk, if you touch the surface of my desk and then you scratch your nose, you've just inoculated yourself. If I cough and then I shake your hand, then you scratch your nose, you've inoculated yourself. But money, touching money, the minuscule volume of virus on the minuscule part of the bill that I'm handling, the risks there are modest, and they always have been. So I think one has to use an informed judgment. If I'm a vaccinated individual, I'm taking money and giving you change and handing you your soda without any hesitation at all. The risks of my acquiring coronavirus from handling bills or handling concession items is minute. So I'm very comfortable as a worker handling these items.
Okay, so we're literally within seconds about of time, but we have a great question that I think that deserves a minute here from our friends at Mark Twain House, Sten. So I'm gonna read this. A bit of a long question, but I think it's gonna maybe give us food for thought for a long time. Currently, the Twain House has a universal mask mandate. In fact, we never dropped the masking. The staff is 100% vaccinated, but we don't require proof of vaccination from our visitors. The other day, we had a visitor who presented a medical mask exemption. We were required by state and municipal rules to accept her exemption and put her on our tour. State and municipal rules say that we have to accept her for that tour, but that if she is unmasked, we're supposed to leave her 6 feet away from everyone. That is not possible, which is why we require the masks. As we know, then there's some tight corners there. The rules are conflicting here. Our solution is this. With her exemption, we can admit her without a mask, but require that she be vaccinated. and refuse her entry if she is not vaccinated. The rules don't seem to spell anything out in that area. Whew. That's an interesting one. What are your thoughts, Sten?
Why is it not possible for that visitor to accompany the tour at a distance? Well, let's just assume that it isn't, given the nature of the event of the venue. And I don't have a glib response to this one. First of all, the whole concept of mask exemptions is a bogus one. Masks are easy to use, are something doctors use and nurses use for hours and hours of every single day. Immunosuppressed persons use them all the time. People who are very sensitive, who have bad asthma, who have bad air quality, they use them all the time. They're used in Asia 10 times more than they're used here. So there's just so much excess energy about how horrible masks are, when in point of fact, I have a lifetime of experience with a lifetime of diverse audiences saying that mask use is not that big a deal. But let's say that they have some obscure reason why they can't use a mask. I would think that if you cannot do the tour and adhere to the regulation of 6 foot distancing, then you could exclude that individual. If they want to sue you, then you can simply say it was not possible to adhere. We were unable to include this person because we were not able to maintain the distancing. And if you wanted to then say, well, we're going to permit them to not be distanced as long as they're vaccinated, but people who get vaccinated are not the ones who are asking for mask exemptions. They tend to cluster in the group of people who want to do everything they can to try to get rid of this pandemic. And so you tend to be eager for vaccination if you're willing to mask and if you're willing to do reasonable precautions around hand hygiene and the rest. So these behaviors tend to cluster. So the anti-maskers tend to cluster with the anti-vaxxers. So I'm not sure that the person would agree, but it seems to me that you're well within your rights to deny the tour to that individual because you cannot accommodate the state rule.
I hope that helps you guys over at the Twain House.
I am not an attorney.
Yeah, he's not an attorney. Actually, to that end, we talked last about Shoreline Arts Alliance working with the Pro Bono Partnership to help gain some sort of opportunity for you all to work with some legal counsel. They're all Pro Bono Partnership is set up for there for you to help, for your help. We have created a COVID-19 procedural template for you to use with your organization. Basically, again, it's not legal advice in any way, but it's it's there to inspire consumer confidence, staff confidence for your open venues or to reopen your venues. So by next week, that will be completely stamped and ready to go. It's going to basically be a menu of items. You as an institution decide what you want to have happen in your venue, and then you can choose the appropriate language to set forth on your website or in your promotional materials. So one more little step in the right direction for consumer confidence. I just need to review it one more time, and my staff does with the legal team, and then we'll get it out to you next week. So we're at 11:05. Sten, Crystal, thank you so much for taking so much time with us today. It was fun to ride in the car with you today, Sten. You made it a little interesting for us, but it was fun. Anyway, thank you all so much. We'll be back together sooner than later. We'll let you know soon when that is. But again, please look out for our survey so that you can make sure you send us information about what's going on in your worlds. Lots of questions still over there in the Q&A. Sorry we didn't get to them, but as always, we will take them into our group and try to figure out how to get that information back out to you, most likely in the next seminar. But if it's something urgent, we'll try to get to it quickly.
Eric, can I have the last word?
Oh, please. Thank you. Yes.
I just want to thank each and every one of you. Crystal and I are huge fans of the arts and of the vibrancy of being a human being in the face of human creativity. I won't say that I'm the most artistic or creative guy in the world, but I derive immense inspiration and learning from the performing arts, from our museums. And the fact that you all have such a passion for getting back to business, you have this attitude that nothing is going to stop you from renewing your mission. That is an inspiration to us. So I just wanted to leave you with that thought.
Well, thank you for everything again, Sten. And from all of us, have a great rest of the week. And thank you for all you do. And we'll be in touch, everyone. And please keep sending us the information so we can keep helping you out the best we can. Have a great day. Take care. And thanks, Task Force, for all your help. Take care. Bye-bye.